quickly go through a brief introduction to economic security for elderly, the interplay of aging, economics, and family health, a brief intro to pension systems and its sustainability, the healthcare financing and access to health insurance, the role of family and community, and a quick recommendation and policy innovations to how to solve the economic security for elderly. So what are the current issues that are going through by our elderly? So let's watch this short video to briefly introduce the type issue for us. Shows us that there are pockets of elderly who are suffering from economic difficulties. So population aging is not just a global trend, it also affects Malaysia as well, as we are moving into an aging nation by 2040s. This trend brings serious economic challenges. The shrinking workforce supporting our elderly will put a strain on our pension system, and this will increase the healthcare needs and costs suffered by our elderly, leading into poverty, health disparities, and great reliance on public resources. So we need to come together and find solutions for this problem. So to define economic security, it is the degree to which individuals are protected against hardship causing economic losses. We are talking about people able to meet their expenses without difficult trade-offs, able to manage their debts, able to save for emergency uses, save for future retirements, and also able to participate fully in society. There are many ways to measure economic security. One way is to look using the Economic Security Index, where we look at household income decline and large medical out-of-pocket spending against buffer capacity, where people have the liquid assets to weather against such massive economic challenges. So who are at risk? Seniors with history of low-paying employment, divorce and widowed women, with elderly of racial and ethnic minorities, they are the ones who are at risk and more risk. However, all senior citizens are vulnerable to economic instability when faced with sudden unexpected life changes such as spouse losses or decline in health status. So moving next, my colleague will take over from me. Thank you very much.
Good afternoon, everyone. I'm Diana. I'll be speaking on the interplay between economics and elderly health, focusing on how financial security or the lack of it shapes health outcomes in older adults. So to begin, it's important for us to frame economic stability as a core social determinant of elderly health. So financial security in old age impacts access to essential needs such as food, housing, medications. When an elderly person lacks income post-retirement, they may delay medical care, skip medication, or settle for less nutritious food due to costs. So over time, this drives higher rates of NCDs, mental health issues like depression, and ultimately premature mortality. As shown in the diagram, economic stability is just one pillar, but it is foundational. Without it, the ability to navigate healthcare systems or maintain safe living environments and stay socially connected is severely undermined. Okay, so in Malaysia and many Asian contexts, families often become the default economic safety net for elderly parents. This is especially true for the sandwich generation. So sandwich generation is those juggling both aging parents and young children. Adult children are stretched emotionally and financially, often facing conflicting responsibilities. This strain is intensified for women, particularly daughters or daughters-in-law, who disproportionately shoulder unpaid caregiving duties. And the implications go beyond emotional fatigue. It affects their women's workforce, it affects their participation, their career progression, and the long-term financial independence. In short, the burden of caregiving is a silent driver of gendered economic disparity in families. Let's now look at the direct health consequences of financial insecurity in later life. Elderly individuals with insufficient retirement savings are at higher risk of poor health outcomes. They delay or forego care, they choose cheaper or less nutritious food, and experience significant emotional stress. These factors heighten their risk of chronic illnesses and mental health problems, including anxiety and depression. Furthermore, when older adults are financially dependent on others, they are most vulnerable to elder abuse, which is often hidden and underreported. In Malaysia, this issue is compounded by a stark financial realities. According to EPF's 2022 report, nearly 48% of members aged 55 have less than 10,000 ringgit saved, barely enough to sustain even 5 years of basic living. This paints a worrying picture for elderly health resilience moving forward. Now let's consider gender dimension of pension insecurity. In Europe, women aged 65 and above, they receive pensions that are 29% lower than men. And while some countries have actually made progress to narrow this gap, the fact remains female pensioners consistently face higher poverty rates. This is relevant for us in Malaysia too, because gender disparities in retirement income are tied to broader systemic issues like wage gaps, caregiving rates, and lower labor force participation, especially among women, all of which affect their ability to save for retirement. In Asia, the gender disparities are often even more pronounced. On average, women receive 26% less pension income than men, and only 26.3% of working age women are enrolled in pension schemes, compared to 38.7% men, right? This disparity is linked to women's greater involvement in informal and lower paid sectors, as well as frequent career interruptions. Why? For caregiving and for childbirth, right? These economic disadvantages are compounded by longer life expectancy and higher late life care needs among women, which means they live longer but often poorer and sicker lives. So the link between economic security and elderly health is undeniable. And as future public health practitioners, we must advocate for policies that not only strengthen the pension systems, but also support caregivers and ensure health coverage is inclusive and accessible for all elderly. I'll pass on to my next speaker.
I'll start the next section on pension system and sustainability. I would like to share a short video.
Thursday, hundreds of elderly citizens queue patiently on Jalan Sayur in Kuala Lumpur for a meal that will hopefully keep their bellies full for the day. Among them is Helen, 68, who has come to receive food provided by Food for You, an NGO that has fed the poor and homeless every week for the last 2 years.
My elder brother 2 years ago passed away, so I got one brother from Malaya. He don't invite me to go home. So I didn't go home for 3-4 years. I stay in KL, so sometimes we go here and there. People, NGO give food, meet friends. Because I'm not working, so that's how we survive now.
James, 56, says he would rather be independent than trouble his children. These are not isolated cases. Others lining up for a plastic bag of food, snacks, and fruits include Lee, 73, who lost his wife several years ago and says his children no longer look after him. Meanwhile, Chong, 80, claims her children do not give her enough food. Tony Lin, the founder of Food for You, who started feeding abandoned senior citizens in 2015, said the homeless situation is heartbreaking to see and the result of a generational shift where money is prioritized over family.
I have lost count of the number of old people that I've sent to shelter home. And it breaks my heart. It simply breaks my heart simply because I was brought up from a family who were taught to respect their elders. I respected my parents. I looked after them and cared for them. My children now have seen what I've done. They are following me. They are now caring for me. That should be the way humanity should be. Love and care for one another.
The Statistics Department previously said Malaysia is expected to reach aged nation status sooner than expected, with over 17% of the population expected to be aged 60 or older in 2040. Malaysia is projected to become a super-aged society by 2057, with 20.5% of its population projected to be over the age of 60. Panujo, FNT.
It's truly heartbreaking to see these senior citizens in the urban city of KL abandoned by their children with no fixed income, struggling with financial security in their twilight years. So without a proper pension system, we can easily face this crisis when we are in an older age. So this is a financial life cycle. So it's a journey of earning, saving, spending, and managing wealth throughout stages of life. So at childhood, we actually depended on our family, and then as we enter workforce, we start to earn income and accumulate our wealth. And later we start family, we acquire assets, and continue to building more wealth. But the age of 50 to 60, retirement begins, and the wealth starts to accumulate. And as we grow older and our physical ability declines, we will spend more on healthcare as well as elder care services until we eventually pass on. So every stage of each stage is very important for proper planning so that we can have security and stability in later age. So the World Bank actually promotes a multi-pillar approach to pension system, suggesting combinations of different funding mechanisms to ensure adequate and sustainable retirement income. So it consists of 5 pillars, from pillar 0 to pillar 4. So how did Malaysia actually implement this pension system? So under the pillar 0 is aimed to reduce poverty but provide universal minimum level of protections. So in Malaysia, the key example is the Bantuan Warga Emas. Pillar 1 and 2 cover income replacement during retirement. So Pillar 1 cover our civil servants under the scheme pension Penjawa Awam, whereas most of the private workers are covered under EPF under Pillar 2. Whereas in Pillar 3, it offers supplementary income through voluntary contributions. So for example, it's our EPF, ISARA, ISUI, private insurance, as well as private retirement scheme. Pillar 4, the last one, cover a range of non-financial support, such as informal support from family, as well as formal support from public healthcare system. So the World Bank say an effective pension system must equip of these 3 key principles: adequacy, sustainability, as well as equitability. So is Malaysia's current pension system adequate, sustainable, and equitable? The first one, is it adequate? Alright, so Pillar 0 assistance, the Bantuan Warga Emas actually offer B40 elderly and they provide 600 ringgit allowance monthly. But this amount is way below the minimum acceptable standard of living levels. Whereas a lot of workers in Malaysia have inadequate saving in their mandatory and voluntary retirement funds, including EPF and private retirement scheme. Is it sustainable? Okay, so the demographic change in Malaysia has caused a decreased labor workforce and fewer taxpayers. At the same time, a growing elderly population has increased the dependency ratio, and this has caused a sharp increase in the cost for pensions. And it's expected by 2040, the payment for public pension and gratuity payment will reach 122 billion a year. And is it equitable? So currently our pension system, the coverage is uneven. Pillar 1 and Pillar 2 only cover those formal workers, whereas those informal workers, gig workers, and self-employed persons are always left out. And the amount covered is also uneven, with the civil servant have a more generous amount covered compared to the EPF-based retirement. So in the global context, countries like Japan, Netherlands, and the Nordic countries has successfully implemented the effective pension system. So the key strategy here is include a multi-pillar approach as suggested by World Bank, okay? But built with sustainability and mechanisms such as wage indexing, lifestyle condition, as well as demographic adjustment. Another critical success factor is integration of the pension with universal healthcare and other social support such as long-term care as well as housing. So integrating pension with healthcare maximizes the well-being across generations, and by ensuring sustainability and adequate income in the old age, this system has shown to reduce intergenerational dependency as well as family financial strain. So next I'll pass to my colleague to continue.
Thank you. Good afternoon, everyone. I'll be taking over for next subtopic, where we focus on current healthcare financing and access to insurance for elderly. As the population ages, many older adults face significant healthcare challenges, from managing chronic illness to affording long-term care. So how well are we financing our elderly healthcare? Malaysia operates a dual healthcare system comprising a heavily subsidized public sector and a fee-for-service private sector. For the elderly, public healthcare provides significant benefits, including waived outpatient clinic fees and also discounted hospital admission charges. However, patients are often required to top up for unsubsidized items such as medical devices, medication or specific procedure. While public healthcare remains affordable and accessible, it is frequently burdened by overcrowding, long waiting times, and lack of long-term care service. To help fill the healthcare gap for older adults, especially those from low-income group, Malaysia has several public and community-based initiatives. For example, the Medical Relief Fund or Tabung Bantuan Perubatan, but this is only for elderly who are verified as poor. In Selangor, program like Iltizam Selangor Sihat and Bantuan Sihat Selangor provide up to RM10,000 for hospitalization and cover minor surgeries and medical equipment, but only for Selangor residents. Zakat Fund support Muslim asnaf communities with chronic illness care, emergency aid and dialysis, but they are not available to non-Muslim. PKB40 offer free health screening, aid for medical devices and transport support for elderly in the B40 group. While these schemes are helpful, they are all targeted, come with eligibility condition and cannot usually be used together. So not every elderly person can benefit from them. On the private side, healthcare is mostly paid out of pocket, which can be a heavy burden, especially for elderly individuals with multiple health issues. Some rely on EPF withdrawal or pension, but this doesn't apply to gig workers or self-employed who often lack formal retirement savings. Another option is private health insurance, but here lies the issue. Many elderly are already retired with reduced income, making insurance unaffordable. In fact, premium can rise by 40 to 70% as they age. On top of that, many are excluded due to pre-existing conditions. While insurance plans like PRU Senior from Prudential or MSIG Senior plans are available, uptake remains low. As a result, a large number of older adults remain underinsured, leaving them vulnerable to catastrophic health expenses. As you can see in these newspaper articles, mention that insurance companies offer cheap price to customers when they are young, but hike up premium when they are older, and often after retirement, forcing them to cancel the policy. Now let us take a look on this video.
Malaysia's middle class is facing a brewing healthcare crisis as escalating medical insurance premiums, driven by a 12.6% medical inflation rate in 2023, threaten their financial stability. Public health consultant and physician Dr. Faisal Izwan Mustafa warns that proposed premium increases ranging from 40% to 70% may push more M14 households to terminate their policies. He said this would leave the middle class exposed to catastrophic health expenses as they may be unable to afford unexpected medical bills, forcing them to rely on the already strained public healthcare system. Azul Muhammad Khalid, CEO of the Gildan Center for Health and Social Policy, said soaring medical inflation and insurance premiums is a financial disaster waiting to happen for many Malaysians. He said this inflation would lead to an increase in out-of-pocket payments for health expenditures, particularly affecting older, vulnerable individuals at risk of financial catastrophe from a single medical incident. Azul also criticized the lack of regulation on medical bills from providers like private hospitals and called for the establishment of an independent statutory commission to oversee and regulate healthcare charges. Natasha News, FMT News.
From the video, we can see that soaring medical inflation and insurance premium is a financial disaster waiting to happen for many vulnerable Malaysians, especially the elderly, even in middle class category. So why does insurance matter? We are seeing a rising trend in multiple NCDs among the elderly, which can increase the demand for long-term and complex care. This put more pressure on already overburdened public healthcare system, leading to longer waiting time at government facilities. Fourth, both public and private healthcare now pose a risk of catastrophic out-of-pocket expenses, especially for those without sufficient insurance coverage. And lastly, we lack a sustainable long-term care financing model, leaving many families financially unprepared for elderly care needs. Insurance can play a transformative role. It pools risk to protect savings. It provides faster access to private care, sometimes cutting waiting time from months to weeks. It enhances psychological security for the elderly, knowing that health issues won't lead to financial ruin. And also it reduces the burden on families, preventing the sandwich generation from sacrificing their own financial stability. To address the rising healthcare costs, Bank Negara Malaysia has introduced 5 strategic trusts. These are aimed at curbing medical inflation, improving insurance access, and also ensuring long-term financial sustainability of healthcare. Some of the key strategies include encouraging healthier lifestyle, improving pricing transparency for medical services, and also promoting the development of affordable insurance products that cater to the seniors. It also emphasizes public-private partnership, digital innovation, and also stronger consumer protection to ensure patients are not exploited by unpredictable medical charges. These initiatives reflect a broader shift. Malaysia is not just reacting to aging, but actively planning for a more financially secure and inclusive healthcare system for the elderly. Now let's take a look at Japan, which has one of the best elderly care systems. They offer compulsory long-term care insurance starting at age of 40 and minimal out-of-pocket costs due to heavy government subsidies. Their system is centralized and integrated, ensuring elderly people receive community-based care. In contrast, Malaysia's system is decentralized and largely reliant on mixed public-private arrangement. While universal coverage exists, long-term care and community support remain fragmented. Clearly, there is a lot Malaysia can learn from other countries. I will now pass on to the next speaker.
Thank you very much. Alright, so I would like to continue with the roles of families and communities in the health securities for the elderly. So, first we know that family is the primary support system for the society. So in many countries, without universal pensions or health coverage, elderly parents most times rely heavily on their children's incomes or child care support systems, or maybe their daily life living. So this is especially true in Asia and in Africa, where the system is limited in terms of providing some of these amenities for these elderly people. So, as a rule. So we're also looking at the situation whereby in the rural areas, if this information or maybe limited access to healthcare cannot be provided, what are the challenges and how can the family support in this case as well? Okay, so we also have the issues of the community centers providing help, and the religious institutions, the NGOs offering social interactions, mental stimulations, and emotional connection. So this combats loneliness and depression, both linked to poor health and outcomes. So the community also provides affordable access to healthcare. So for example, in the rural areas, the community workers, mobile clinics, grassroots health programs, basic healthcare screenings for the elderly. Now, this reduces the hospital overload and helps detect conditions very early. So we also have the faith groups and the non-governmental organizations filling the gaps. So this is where the religious organizations always provide meals, transportations, housing, and small financial assistance to the elderly in need. So the example of this is the Health Age International in Southeast Asia, where they collaborate with the local NGOs to provide support and care based on the needs of the elderly. Then we also have the grassroots mobilizations who are involved in critical formal systems where the systems are weak or not able to provide some certain instruments for the elderly. So their main role is usually to provide coverage which is of slow or maybe is not even available in the community setup. So while this happens, it shapes each institution's corporate social responsibility to help in wherever they are in the community to make sure that when they step in as first responders, especially in disasters or maybe healthcare crisis.
So this is where I stop, and I'll call the next presenter to continue. Thank you very much.
And the policy innovations. So firstly, strengthening pension system sustainability. Malaysia policy measures such as mandating EPF registration for all workers for granting business lessons, government contracts, and can expand coverage and expand EPF coverage to informal sector workers through micro contributions and mobile apps, and introduce flexible retirement age options and phased retirement. For example, Japan employment system allows seniors to work part-time post-retirement work, and enhancing access. Secondly, enhancing access to health insurance. Expand HEPA B30 to M30 elderly, design a national elderly insurance co-funded by state employer and individuals. And for example, South Korea, they have universal long-term care insurance. And thirdly, promoting intergenerational support. We can provide tax relief and financial incentives for family caregivers, and we can build community-based elder care cooperative. And for example, Singapore, they have silver support scheme and caregiver support grants. And first, investing in healthy aging infrastructure, we can promote preventive care and NCD management, and design elder-friendly hospitals and cities. Faith, governance, and cross-sector collaboration. We come from a national council for active aging and encourage PPP in elder care. And for example, like Sweden, they have municipal-led integrated elder care governance. And six, implementing our new simple social pension scheme. We can use current systems such as Bantuan Sara and HADA to provide a monthly 350 pension, bringing pension to people over 65 in the B40 income bracket can provide a safety net. And seventh, using adaptable elderly products, TDFS offer a flexible approach to retirement savings by modifying investing methods according to an individual's age and risk tolerance. And eighth, establishing elder premium exemption. We can deduct up to 5,000 ringgit in medical costs for their parents, and under specific circumstances, and they can also deduct child care costs, including those associated with elder care. And nine, creating insurance products that are age-friendly, by covering medical costs and paying out the death benefit to the policyholder's dependents. And this policy can provide a holistic approach to financial stability. And 10, integrating the use of AI and general technology. And this can involve using telehealth for remote consultations, smart home devices for fraud detection and safety, and wearables for health monitoring, and all of which can feed data into insurance decisions.